Hello, good morning, everybody, and welcome to Day 3 to Friends of Europe's State of Europe, the festival of politics and ideas to transform Europe. I'm Tamsin Rose, your moderator for this morning, and we're broadcasting to you from our studio in the centre of Brussels. Welcome to all of you, whatever platform you're watching us on. Today, we're going to be looking at the issue of health systems, and we're particularly interested in finding out the future and where it goes. So let me start by sharing with you our third annual poll where we asked European citizens what their priorities should be. And we asked 10,500 citizens across 11 countries, what areas should the EU prioritise over the next 5 years? And a third of them have said they want the EU to prioritise technology, science and research. So that makes it a mid-ranking priority for citizens. But in the year of COVID, when we see extraordinary collaborations to try and find diagnostics, vaccines, and answers to these big problems, research is clearly going to be a key element of our response for the future. So how do we make sure that the technology we have is for good, and how do we apply it to health? I'm delighted that we've got Dr. Bertalan Meško, Director of the Health Futurist Institute, who's going to share with us how tech for good is going to be transforming health systems. Dr. Meško.
Welcome. This is Dr. Bertalan Meško, the medical futurist. We are living quite unprecedented times. The pandemic is going on, our lives have changed significantly, and it seems it's going to be like that for quite some time. So it makes sense to talk about how we will be able to predict the future of healthcare. Please don't worry, I'm not talking about the far-fetched future here. Let's talk about just the next few months, the next few years. It would still help a lot in deciding how to care better for the patients we have today. I think one of the most useful things in trying to predict the future is by reading and watching science fiction. Because what science fiction does is that first, it makes us ask questions that we normally wouldn't ask in our days, like what if humanity's destination is not on Earth? What if an algorithm can provide empathy? Or what if medical technology could be the cure for all? And second, it makes us emotionally prepare for whatever is coming next. It happened to me too. I was a 6-year-old kid when I got a book from my mother about the scientific method. And there I remember falling in love with that method. The idea that we don't understand something like a disease, technology, something that we discovered in nature, and then we do research about it, and then we understand it. I think it's still the most beautiful process in the world. There, I decided that I would dedicate my life to doing research. And being inspired by some books and movies from that time, I was quite certain that by the time I would go to medical school, I would use really advanced technologies in my studies, from virtual reality to devices obtaining health data and artificial intelligence. And of course, none of these things happened. I studied anatomy and pathology like anyone else, from textbooks and two-dimensional images. But a few years ago, I came across a device offering mixed reality. It seemed too good to be true, so I had to try the device myself. It was a head-mounted device which I put on. There was only one button called Start, so I clicked on it, and there it happened. A holographic image of a human body appeared in front of me. I could look around it. It had a beating heart. With my finger movements, quite simply, I could just remove bones or muscles or nerves. I could dissect a human body without physical limitations and the formaldehyde smell. And I felt like this is it. I met science fiction. You know, the technological sublime, that feeling when it tells you that things can get much better because here is this technology that can make things better. First, I'm sure that you will all meet science fiction in your lives, but also I think the pandemic has changed our lives so much that normally now it feels like every day we are meeting something new. Every day there is a change to the lifestyle that we have, to the healthcare that we provide. So it feels like meeting science fiction every day. And it can be frustrating on the long term. It leads to anxiety, because if life is all around only changes, it's really hard to get adjusted to that. But what happened because of the pandemic is that the rate of adoption about advanced technologies has changed. Now we can faster adopt them, because otherwise we wouldn't be able to provide or receive care at all. So it seems like there have been some technologies that have been coming out of science fiction into our lives. Just a few examples. There are countries where medical drones can deliver supplies to people in need. Like in Rwanda, where road conditions are not so great, they use medical drones to deliver medications and devices to people in need. And these drones can fly for 2 days. They are GPS automated, and they can fly in almost any weather condition. This is quite something new, like out of a science fiction movie. Because of the pandemic, we have seen an amazing rise in remote care visits. Way before the pandemic, for decades, we had been talking about the importance of adding telemedical care to the normal doctor-patient relationship, that it would be a great way to support what they do after meeting in real life for monitoring and long-term support. Telemedical care would be great. But there had been some rejection, some lack of incentives, lack of policies. But now it's different. In many countries, either they provided care remotely, or they couldn't provide or receive care at all. So in countries like Spain, the UK and the US, we have seen really skyrocketing numbers about these telemedical visits. The third, artificial intelligence. AI is being used to predict the next outbreaks by public health officials. AI is being used by some countries like Germany to reorganize medical supplies within the country. It's quite clear that in future pandemics, we won't have a chance to prepare efficiently without using some sort of artificial intelligence-based systems. These systems are also being used and are being studied for the use of medical decision-making, how to care better for patients by checking all the data out there and millions of medical studies. A feat, no human being is able to do. So there are these technologies coming out of science fiction into our lives, but I'm sure you get the same feeling as I do, that I don't feel like we meet these technologies in our everyday practices. There is a reason for that. If anyone focuses on the next technologies, I'm afraid they are on the wrong track. Because what has been going on in the 21st century in healthcare is a sort of cultural transformation. It's much more important how the traditional hierarchy of doctor-patient relationship is transforming into an eco-level partnership. How the passive patient can become a proactive, empowered patient. How the burnt-out physician who is forced to do administration in 60% of their time can become empowered e-physicians. Then which microchip or fitness smartwatch can come out next year? We have to embrace this cultural transformation, otherwise we are on the wrong track here. I know it's difficult because it's easier to focus on the technology than all these cultural changes, but just let me give you one example. When in a study they gave patients virtual reality devices, feeling that the patients might feel better while staying at the hospital because they can fly over Iceland in a VR world, nothing happened. But when their physicians could act as coaches during the process, describing the potential expectations and the outcomes and the side effects, it helped. The pain scores were reduced and patients felt better. You see, if we just give technologies to physicians or patients, nothing will happen. But if we use technologies that can support the doctor-patient relationship, then we are on the right track. In a world where patients can obtain so much information about themselves, we can use fitness smartwatches to measure our fitness levels. We can track sleep and use a smart sleep alarm for waking up at the best time. We can measure stress levels. We can have a genetic test from home, learning about what medications we might have a side effect for, or what major medical conditions we have a risk for. We can have a microbiome test from home, learning what diet we should have based on the bacteria living in our digestive system. We can have at-home lab tests, even focusing on COVID. So now there is no ivory tower of medicine anymore. Patients can access almost the same amount of information, and it's really easy to feel left alone in this. Without a partner physician, they are doomed. Without technologies, they cannot measure data. So we are building here a really new kind of network. A network of the doctor-patient relationship aided by advanced technologies. So when we talk about the point of care, where patients can receive diagnosis and treatments, this is the place that everyone knows worldwide. And we must transform this place into this, patients. Digital health makes patients the point of care. This is the long-term vision that we all fight for. Researchers, technologists, innovators, policymakers, patient and medical organizations. We fight for the chance that healthcare can become democratized because patients get access to care no matter where they live, what language they speak, or how much money they've got. This is the long-term mission of digital health. But we won't be able to reach it if we don't embrace the cultural components of this change. The pandemic has indeed led to the faster adoption of these technologies, but if you keep on focusing on the technologies, I'm afraid nothing good will come out of it. On the top of that, if we follow the recommendations of the scientific and medical community, then we might get over this in a year or two, and we can benefit from this larger adoption of digital health technologies. But if we don't, if we decide to protest against scientific facts, then I'm afraid we will live like this with all these social measures and masks for over a decade. This is the decision we have to make now. And if we make the right decision, then digital health will finally bring healthcare into the 21st century. Thank you so much for your attention.
Thank you, Dr. Bertolin, for sharing your insights about how tech can be used for good and how we can make this shift. I'm interested in exploring a little bit more. When you said it's a cultural shift, where does that need to happen? Is it in the minds of the patients? Is it in the minds of healthcare professionals? Is it in all of our minds? Because it's quite radical to think that we, the human being, is the point of care rather than going somewhere else. Where does that cultural shift need to happen?
That's an excellent question. And first of all, thank you so much for having me here. I think it has to take place in the minds of patients first, because they need to understand that without the use of technologies, they won't be able to receive good quality care. But at the same time, without their partner physicians in the process, they would be doomed and left alone with a huge amount of technologies. It has to take place in the minds of medical professionals to understand that we can't press and push them further along the way. We have to give them a chance to enjoy their profession, why they became physicians back then. So this cultural shift does take place in the minds of all the stakeholders of healthcare. And I think maybe it's even easier to think about the cultural shift than to focus on the technologies, because everyone can think about what really matters when you meet a medical professional. I guess it's attention, time, and empathy. But to focus on a microchip or an artificial intelligence-based technology, it's really complicated. So even in the long term, I think keeping in mind and focusing on the cultural shift helps better adopt these new technologies instead of just focusing on the technologies entirely.
Thank you. And you mentioned that about 60% of a doctor's time, a healthcare professional, is right now on administration, on paperwork, all the logistics to manage. How far do you think we can get? Do you see a future where that's down to 5%? Or do you think realistically, even with all these new tools, it's really only going to be cut to, say, 30%? How far can we go to liberate and empower the time of our professionals to spend quality time with their patients?
I think if you're talking about administration being done on paper, if it's more than 0%, no one will go into medical school. That's not why someone becomes a medical professional. They become medical professionals to be able to care for patients by using advanced technologies. And I think there are some digital health technologies that can help facilitate that. But at the end of the day, if we don't remove every interface from the doctor-patient relationship, by this I mean every monitor, every screen they have to look at, then they won't have a chance for a real-life emotional conversation. But they can indeed have a real-life conversation while just being surrounded by seamless, invisible technologies, text-to-speech algorithms, artificial intelligence mining medical records, data coming from patient sensors, and other algorithms trying to get meaning out of this jungle of information by putting the right piece of information into the hands of physicians so they can make better decisions with their patients.
And just one last point, if we're shifting paperwork away from doctors and we're making the patient the point of care, I hope we're not going to end up with a huge responsibility on the shoulders of the patient to not only to manage their own conditions, but then manage all the paperwork and continuity of care. I'm hoping that you're going to tell me that all of that gets shifted to an AI system behind the scene, because if you're unwell, the last thing you need is then have to manage all the different inputs from different healthcare professionals.
Well, now all this responsibility is on the shoulders of medical professionals. So the solution is clearly not putting the same amount of responsibility on the patients instead of physicians. I think the solution here is to let them share responsibility and make sure that all the relevant information they can need in the process of decision making will be at their disposal, because not human beings checking medical studies can bring those to them, but maybe artificial intelligence based system can make sure that everything they need to make the best decision for that patient, and by they I mean the physician and the patient as a medical team, will be at their disposal.
Okay, thank you very much, Bertolem, for sharing your insights with you. And I'm now going to move to our next session, which is entitled Rethinking World Health Systems. Now, that's a big title for a big issue. COVID has shown us that we are all globally at risk. It has highlighted for us once again the interconnection between the planet, people, and our environment. And the virus that was unknown at the end of last year has now affected every single part of the planet. So this morning we're going to explore what lessons we've learned and how we move forward to make sure our health systems are more resilient. Let me welcome our global audience. You can engage with us either by using the hashtag #StateOfEU on Twitter. Those of you who are watching us on the Zoom platform, please feel free to engage with the chat. Share your ideas, your comments, if you think there's an interesting piece of information. This is part of the rich conversation that we will use, because all ideas are welcome. We're in unknown territory here. We don't know yet where this is going to end. The pandemic, it's been ongoing. We're now facing possibly second wave and beyond. So we all need to work together to find a solution. And just as a reminder, the figures are changing every day, but globally there have been more than 35 million confirmed cases and over 1 million deaths, and that's just since the beginning of this year. So the situation is febrile, it's moving, and we need our best ideas to find solutions. And let me just share with you the insights of a citizens' poll. We asked 10,500 Europeans from 11 member states where the EU should focus in the coming years. And almost half of them want the EU to take a leadership position to control the spread of COVID-19 by coordinating EU-wide health systems. And that's a big shift, because traditionally health systems have been seen as a precious jewel as part of national culture and not coordinated at European level. And this shows us how much people are looking for leadership, how much they want to see global coordination. And of course, the person to whom we're all looking for global leadership and coordination of our health system response to COVID-19 is to the World Health Organization. And it gives me great pleasure to introduce the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros, welcome. And let me start by asking you, what has COVID-19 taught us about our health systems globally? Dr. Tedros, welcome.
Yeah, thank you. Thank you very much. Do I do the speech first, or you want me to go straight to the question?
Please go ahead with the message you wanted to share, and then you can answer the question.
Okay, thank you very much. And thank you for having me. I'm glad to join you today. And I would also like to use this opportunity to appreciate the European Union for their very strong support to multilateralism, and also to fight against this pandemic. Excellencies, dear colleagues and friends, good morning, and thank you for the opportunity to share a few reflections with you today. The COVID-19 pandemic is radiating shockwaves across countries, their populations and economies.
Okay.
As you know,
but it's the same, because we are mute us, but
is now seeing an increase in reported cases. More cases have been reported in each of the past 6 weeks than at the height of the first peak in March. Countries at all income levels are affected, and the rapid emergence and spread of the virus has revealed critical gaps in national health systems capacities. The pandemic has disrupted economies and overwhelmed even some of the most advanced health systems, while some of the measures taken to respond to it, such as so-called lockdowns, have badly affected many people's ability to earn their livelihood. Even as we use every tool at our disposal to end the pandemic, we must all use this period of crisis as an opportunity to look in the mirror and ask what we must do differently. Today, I would like to suggest 3 fundamental shifts that WHO believes all countries must make. First, invest in public health. In recent years, many countries have made huge investments and advances in medicine, but too many have neglected their basic public health systems, which are the bedrock for preventing, preparing for, detecting, and responding to outbreaks. In other words, too many countries have prioritized the medicalization of their health systems at the expense of the basic measures that prevent people getting sick in the first place. WHO believes that the single most important action all countries can take is to invest in essential public health functions. This includes immunization, surveillance, laboratory capacity, infection prevention and control, health promotion, vector control, and improved water and sanitation that can help us be better prepared. It also includes essential governance functions such as regulation to ensure quality and accessibility, and taxation to raise revenue. These common goods for health provide an excellent return on investment, yet they are regularly underutilized. Indeed, many aspects of the current crisis can be attributed to disinvestment in core public health functions, as well as short-sighted social, economic, and environmental policies. Second, take a One Health approach. The pandemic has highlighted the intimate links between the health of humans, animals, and planet, which we can only address with a One Health approach. Any efforts to improve human health are doomed unless they address the critical interface between humans and animals and the existential threat of climate change that's making our Earth less habitable. WHO recently published our manifesto for a healthy and green recovery with policy prescriptions for protecting natural resources, investing in water and sanitation, renewable energy, healthy food systems, and livable cities. It includes more than 80 specific actions for governments at all levels. Third, go beyond the health sector. The title of this session is Rethinking Health Systems. I respectfully suggest that that is far too narrow. We will not prevent the next pandemic by focusing only on health systems. The pandemic has affected every sector, so it stands to reason that every sector must be involved in the recovery and in the preparedness. We must also address the reasons get people sick and die in the air they breathe, the food they eat, the water they drink, and the conditions in which they live and work. Just as the pandemic requires an all of government, all of society response, so does promoting and protecting health. Invest in public health, take a One Health approach, and go beyond the health sector. These are the fundamental shifts I believe our world must make, both to safeguard against future health emergencies and to promote and protect the health of everyone, everywhere. I thank you. And I hope the question is also covered in my speech, and I'm glad that we're aligned. We believe that these are the 3 most important things to do, among others. Thank you so much again for having me.
Thank you, Dr. Tedros. And let me ask you a question, because when we asked our citizens what they wanted the EU to do, they mentioned very strongly that they wanted to have collaboration across health systems. And obviously, this is a global pandemic, and we need global collaboration. To what extent do you think countries are really ready to engage in a shared responsibility to address the pandemic? Because certainly in the beginning, we saw a response that was very much, let me protect my own population. But we've seen in a globalized world that viruses don't stop at borders. So within the WHO, are you seeing a recognition amongst countries that multilateralism and investing in shared capacity is the way you protect your own population?
Thank you. No, I fully agree on that. As you rightly said, viruses don't need visas, or they don't stop at borders, as you rightly said. And cooperation is very, very important. And cooperation not only at global level, but at regional level too. For instance, as what many citizens from the European countries have said, cooperation or integration at regional level, at EU level, will be very, very important, and we encourage that. And we're supporting, by the way, the African Union, and the African Union is doing the same thing. And not only European Union, other regions can do that. The ASEAN, the Pacific, the Caribbean, the Latin America, and so on. So strong national capacity, strong regional cooperation, and strong global cooperation. When you see now where we are, one of, more than the virus, one of the major problems is lack of cooperation and solidarity. You see cracks between countries, especially major powers, and that crack is being exploited by the virus. I can say it with full confidence that if we were united, we wouldn't have been where we are now. We could have reduced the damage, which is already incurred now. And even going forward, I can say it's still, not late to cooperate, ensure solidarity, and fight this virus together. But we have paid dearly because of the division, the lack of cooperation, and lack of solidarity or weak solidarity. And I fully agree with the survey you did that the citizens have spoken. That's the right way to go. That's the right thing to do. And that's actually the only option to have in terms of, fighting common enemy, which can move across borders easily. Thank you so much again.
Thank you, Dr. Tedros. And let me now invite Jean-Luc Lemercier to come in on our conversation, the Corporate Vice President for Europe, Middle East, Africa, Canada, and Latin America of Edwards Life Sciences. Now, we just heard a prescription from the WHO about what we should be doing about our health systems. And Dr. Tedros said very clearly that an underinvestment in public health and in the sort of core fundamentals of our system have created some of the gaps that we see. So let me ask you, COVID has been like a magnifying glass on our health systems and have revealed some quite significant structural problems. What have we learnt about this, and what do we need to be addressing going forward? Jean-Luc.
Thank you, Tamsin, for the question. Good morning, everyone, and thank you for having me there with you today. Definitively, this crisis has brought some learning, I guess, for all the government, all the population. And where I'm sitting, what I saw, probably three major points. We have learned first on the disease itself, because the disease is not, some diseases are different from other diseases. This one is an outbreak virus and touching all the population. Among the European population, what we have seen, the elderly people has been the most affected. In addition to that, we have seen that people having cardiovascular disease has been more affected than the rest of the population. And when you look at the fatalities, which is the numbers is serious across Europe. And what we have, what the paper, what the research, what the community of doctors are saying is that about close over 60% of the people who passed away were more than 65 years and with a cardiovascular disease. So there is clearly a connection there for this outbreak and the connection with this disease. And there is the other point we should not forget for Europe. Cardiovascular disease is the #1 killer for the population. So you have a sort of double punishment here for this subgroup of the population. The other thing we have noticed due to the tension on the hospital, the cardiovascular patients were not able to get their treatment as scheduled. And during some period in some country, half of the patients were not able to access the hospital to get their treatment, which create another tension on this population. So that's one thing we have learned on this disease, which has been, as I said, devastating for this group for this portion of the population. The other thing we have witnessed as well is what's happening during this situation with hospital, how hospital management can evolve to deal with this situation. As we know, the hospital have been under high tension during the period, and they have to re-engineer the operation to face to the situation they have to deal with. And we have seen some hospital doing some movement, because what you need to acknowledge in the hospital is some innovation in therapy, in treatment, may have some benefit during a normal period and probably generate huge benefit for the patient and the system during this outbreak. And some innovation in the cardiovascular area, in my area, which basically are triggering more minimal invasive intervention for the cardiovascular patient, have been probably used more during this period in a lot of hospitals, just because those interventions are lighter than regular surgery. The patient didn't stay so long at the hospital, which was what the hospital management wanted. In addition to that, some medical society, cardiology society, have encouraged doctors to privilege those minimal invasive intervention during the COVID period to manage those situations. Okay. So what does it mean for us? The point of learning is to say innovation has helped somewhere during this period. But when we are going to get out of this situation, those innovations should stay in the hospital and to be used at a larger scale than they were used before the outbreak. Excellent. The last point I wanted...
Yes, please go ahead.
Last point, I'm sorry, I'm always long. And the last point, what we have noticed as well, we have seen some countries struggling more than other countries. And what we have noticed, we have a relationship with the previous crisis, the 2008 crisis, and some countries have reduced their investment in healthcare. And we have seen those countries with a reduced budget over the last 8 years struggling more to deal with the situation at the hospital level. That's why this notion of investment is becoming now a critical point for the future. So this is something we probably are going to talk later on today, but this is a critical point. Having funding is important. Allocating adequately this funding is becoming critical now.
Thank you very much.
Thank you.
And in fact, this question about where do we invest in a smart way is one we're now going to pick up on, because if you remember our first intervention this morning, Dr. Bertolin-Meshko, it described how there's been a rapid shift and uptake of digital technologies. Dr. Tedros said we need to remember to invest in core public health services. Jean-Luc, you've just explained to us that some of the shifts that happened to be more efficient, more effective, use lower interventions and lower intrusive interventions should stay after the pandemic. Let me now introduce Jana Remmers, who's a partner at McKinsey Global Institute. And the question we're going to ask is exactly following on from our previous speakers. How do we get the best from our investments in human health? And you recently published a report where you show where is the best return on investment in the way that we work on health systems. And I believe we have a slide we'd like to show for you. Could we show the slide, please?
Great. Thank you so much, Tamsin and Friends of Europe, for having us join. This is a great question on where to invest, and I think it's especially important for us economists, for whom health has been not part of the growth discussions or the economic discussions or the upside discussions at all. We have tended to focus on the cost of healthcare and whether we can afford it in the aging societies. And this really, in our research, we found that that is a mistake. Even before the pandemic, the European economy lost 3 trillion in GDP in US dollars, simply because people either died prematurely or suffered from conditions that kept them away from being economically and socially active. So when we start asking your question, Tamsin, on where should we invest most, a good place to start is to understand what is the cost and what are the diseases that are most burdening the European labor force today? And that is what the slide is describing. So if you put that up, I can describe what we did in our research. We basically started by understanding the burden of health in the European population by age cohort. And as someone who has tended to think of health challenges as mostly related to aging, I was surprised to see that 2/3 of the healthcare cost, of the health cost, really occurred of people in their active working years. We then took that disease burden and estimated what is the impact, because people either die prematurely or suffer from chronic conditions that keep them away from participating in the labor force, or because they have to care for someone they love and for that reason can't work outside of home. We added to that the productivity cost of people being at work but worrying about their or their loved ones' health conditions and for that reason not being able to contribute. And this slide synthesizes how that costs the economy for each age cohort of 10 years. And as you can see, the diseases that most burden the working age population in Europe are musculoskeletal disorders. Lower back pain is one of the most important factors here, where Europe actually has the highest prevalence of all regions. The second one is mental health conditions. If you would like to still continue to share the slide, you can see the second turquoise color shows you the mental disorders that include anxiety and depression. Neurological conditions are a third category, and that includes migraines, headaches, as well as strokes. And when you add together all the other diseases, collectively, that cost European economy $3 trillion, which is almost twice as much as the estimated cost of COVID this year. So I think this gives us a very clear answer to the question of where we should prioritize if we really are interested in countering some of the negative labor force growth trends that are coming with aging. And I think on the flip side, there's a big opportunity to do better and boost both health and growth.
Excellent, thank you. And in fact, you've flipped the conversation around, because the conversation usually tends to be that the largest proportion of healthcare costs is attributed to the older part of the population. And what you've done is you've helped us to look actually what is the cost to our economy of the burden of disease, which is not the same as healthcare costs. And when we see there that we're losing the economic value of people in their working age by not keeping them healthy, it's clear that there's a logical sense to invest more. So, what do you think is the power of health to increase our economic growth? We're tipping on the edge of what the World Bank and the IMF said is going to be our deepest global recession for 120 years. So, the power of health to lift our economies and grow our well-being is clearly going to be important. What's the potential, do you think?
And that is the exciting part. When we looked at the clinical evidence of how much better we could do against this disease burden, about 30% of that burden in Europe could be addressed and avoided over a 20-year period in Europe. so that by 2040, we actually could be a third better in health across the board. And the benefits would be very large, both for individuals. We actually could add 10 active, healthy years to everyone's life. We could make 65 the new 55. Who wouldn't want that for all of us? And on the economic side, it could boost the European economy by $2.5 trillion in 2040. That translates to a 10% lift of the projection today, or 0.5 percentage point faster growth every year. So that is exactly what we would need right today. And it doesn't need to add to our healthcare costs. With just a moderate improvement in efficiency, we actually could achieve these benefits without having to spend more. So we really hope that as we look ahead, we take advantage of the once-in-a-lifetime opportunity to not merely return to the past and do healthcare and the way we used in the past, but really invest on health to improve both the quality of life and boost our economy when we right now need it the most.
Excellent, thank you. And we're going to share with our audience in the chat and the online platforms the connection to your report so people can see the background and the data that you gathered. And please feel free to participate in our conversation because I'll be opening the floor quite shortly. The State of EU is the hashtag to use on Twitter. You can use the chat functions on the other platforms and we'll be taking your comments in the coming moments. Next, I'd like to turn to Ricardo Baptista Leite from Portugal. He's a founder and president of Unite and a member of the Portuguese National Parliament. And of course, for Friends of Europe, he's an old friend. He's a member of our European Young Leaders cohort. Now, let me turn to you, Ricardo. We got a prescription from the WHO on what we should do. We need to invest in public health, take a One Health approach, and go beyond the health sector. Those are very political prescriptions, and politics is your game area. So let me ask you, what do you think are the political lessons from COVID-19?
Well, thank you very much, Tamsin. It's really great to be with you and with everyone at Friends of Europe, and also to greet my fellow colleagues in this panel, particularly Dr. Tedros, who I would like to commend for his tremendous work in leading us in the middle of this global storm that we are facing. And also as a European young leader, to see Friends of Europe being able to put this together is quite astonishing. I have to say that what I've been experiencing personally as an infectious diseases physician in political office, but also through the Unite Global Parliamentarians Network to End Infectious Diseases, is that there are some diagnoses that we can make right now from a political perspective. First of all, globally, we were not prepared to deal with these kind of crises and with these kind of pandemic threats, if you will. And despite all of the messages and signs that even WHO and other global and public health organizations have made over the years, and the scientific community, countries have not been able to prepare. And that is seen especially at the country level, where we see that public health structures were not ready, but also in the cross-border approach and the coordination at the multilateral level in being able to prevent what we are living. The second thing is that global health was clearly not a priority. And what we've seen in the political field is that most politicians had no idea what WHO is actually mandated to do. They were expecting many different things from an organization that has 20% of the budget of the Portuguese health system, which is something astonishing because people have no idea how low resourced WHO is. And many people think that they are responsible for making countries to intervene on the ground, which is not the reality. Countries have to do their job. WHO is a technical body, and this lack of understanding compromises them. It leads to a weak response at a global level. The other lesson that is very clear is that since we were not prepared, we are learning as we go, which means that we are reacting. And that is the worst that can happen when we are dealing with a crisis of this magnitude. And fourth diagnosis, if we will, of what we're facing is that poor health leads to poor outcomes. And what I mean by this is that we can see in this pandemic that those countries that have high burden of disease, high burden of chronic diseases, are the ones that then present higher mortality rates. And so what do we need to do? And I would say that we need to go from defense to offense. And this means that we need to understand that the economy and health are two sides of the same coin. And if we do not solve the issue of this pandemic in each country and be able to coordinate ourselves in a cross-border manner, we will not be able to keep our economy running. To do that, we need to make sure that we are capable of responding and lowering the number of new infections. Because many times we say that hospitals are the front line, we need to make them the last line of defense. We need to make sure that we are acting in the public health sphere, making sure that we are preventing and identifying those people that are infected, those that are suspect, and isolating them. At a global level, from a global health perspective, understanding that WHO is a scientific technical body, we need to acknowledge that we need to have better public health systems to respond to biological threats on the ground, but we also need to coordinate ourselves at a multilateral level. So maybe we do need to consider something like a NATO for health, or an organization of some sort at a global level that can coordinate these emergency response bodies that have to be prepared and simulate for similar situations in the future so that we can be better prepared. The second thing from a political perspective is that we need better firewalls to avoid the political interference of what technical and scientific bodies are telling us to do. The political noise and rhetoric have led to poorer results in terms of the health outcomes that we need. The third is that we need to invest more in terms of research and development, from diagnostics to treatments, to preventive measures, to public health and global health management. This is a field where we truly need to work. Two last points, just to say that we need to rethink our health systems, and we can discuss this if you will, because clearly, as was mentioned before, we need the health in all policies approach, which means that we need to transform our disease health systems towards being focused on well-being. And that leads to the last point, which is focusing now into the decade to come, as we hopefully will move from the pandemic to the post-COVID world. We will need to deal with the economic and social strains that come out of it. And dealing with that means that we need to protect those that are most vulnerable. That is the first responsibility of all states, which means we should use the Sustainable Development Goals as a beacon of the lighthouse that can lead the way to make sure that we don't leave anyone behind.
Thank you very much. And you've clearly set out for us some ideas of how we can move forward and how we can change. And again, you've made it clear to us that part of the challenge is people didn't really know what the WHO is, what it could do, and its powers or lack thereof and its resources. And that usually only happens in an emergency. That's when we look around for the expert to help find our way forward. And certainly in her State of the Union address, the President of the European Commission has announced her clear commitment to multilateral processes and her support for participating in the discussions on the reform of the WHO so they're able to meet the next challenges that come forward. And I wonder if we'd like to invite Dr. Tedros to share something at this point. This message of how to strengthen and reform the WHO so that we can deal with some of the pandemics that are coming in the future. Dr. Tedros, would you like to share anything about how you would like to see the reform process go?
Thank you very much. The last 3 years, actually, we have been, trying to transform the organization. And probably some colleagues who have been following what we have been doing. We launched the first design of the transformation March 2019. And most of it was to do with emergency preparedness. We established the Division of Emergency Preparedness. We also established a Science Division, which is led by a chief scientist. That's also the first ever, the first post in WHO. And this was also to accelerate research and development in emerging diseases. And we have established now, and it's up and running, by the way. We're training a lot of people globally, millions, through our WHO Academy, and so on. I mean, I don't want to take your time by listing all the changes we're trying to make. So we have been preparing, actually, knowing that one of the problems we have globally was the unprepared world for any emergency. So we have been working on strengthening and reforming WHO. Now there is this opportunity even to do more. So we're incorporating more by learning lessons from this pandemic and implementing it together with what we have been implementing. And we have to be not only WHO, I mean, the whole world should look into the mirror. We should really be prepared to learn lessons from here. This is a crisis, but at the same time, a great opportunity to learn and build back our future better. So there should be an honest, very honest assessment of what happened, what's happening, learn from it, and prepare to build a better future that can help us to see anything like this, like never again. So strengthening WHO will be very important. But one thing maybe I would say to what Ricardo said is in the reform, the emergency preparedness, the coordination is already here. That's why we help DRC in addressing the Ebola. As you know, we finished the Ebola epidemic in DRC recently, and we're working on this pandemic too. So with more investment, WHO is actually more prepared to coordinate pandemics going forward. So if we can identify the areas, the gaps, and build it together, instead of having mushrooming institutions, it's better to strengthen WHO, because we're saying the same thing and we're doing the same thing. It's a matter of building on it. But I said it earlier, it's not the strengths of the global cooperation that will help us to fight pandemics in the future better. It's the strengths of the national capacities. And I have said it earlier, by the way, compare many advanced countries, developed countries, with countries, for instance, in the Mekong region, which are mid or low income or middle income countries. They fought this pandemic better. Take Thailand, take Laos, Vietnam, because they have stronger public health and investment in primary health care. While in developed countries, the investment was in medicines rather than in public health and primary health care. So the national situation, the national capacity is actually central. And then, as you said, based on the surveys, regional capacity also important. Then, of course, the global coordination also comes. But yes, the most important is building from the grassroots, from the country up to region. And then the global coordination is also important. And we can discuss further with Ricardo and others, but there is already a clear vision on how to strengthen, which started actually 3 years ago, to strengthen the pandemic preparedness coordination. Thank you again.
Thank you very much. And as you say, the global response rests on the regional coordination and the strength at national level. And public health, we heard that from some of our earlier interventions. A failure to invest in core public health functions has left us all vulnerable. And as a reminder to everyone, if you want to contribute to our conversation, please raise your virtual hand or let us know in the chat through Zoom, or you can use the hashtag #StateofEU on Twitter. And I would also like to welcome our cartoonist who's live here in the studio. We've shown some of his cartoons as we've gone forward. He's listening to our debate and interpreting it in his own unique way. Let me now hear from some of the audience. And we have a question that's been submitted on Twitter by Alex. Let's have that question put forward, please.
Tamsin, thank you. Good morning, everyone. So our question is, many procedures in the healthcare sector have been simplified during the pandemic due to an increase in digital tools. How can we ensure that we keep advances in online prescriptions, virtual doctor visits, and so forth, while safeguarding privacy rights of patients?
That's a very good question. Thank you. And in fact, that refers back to some of the messages that we had from Dr. Meshko, which said, we've done this big shift and we should keep them because they've freed up some space for interaction. We've taken some of the paperwork away, and it's a possibility to increase access. So that's a good question. Let's explore that as we hear from some of our other people who want to come in. Nina Rawal, I believe you would like to come in, and would you please introduce yourself before you make your comment? Hi, Nina.
Good morning, everyone. My name is Nina. I'm a Stockholm-based European young leader like Ricardo. I'm a scientist by training, and I work in venture capital. And my question today would be to Dr. Tedros. Thank you for all your work. You keep on communicating that we are nowhere near the end of this pandemic, unfortunately. So I'd love to hear your thoughts and the WHO's evolved thinking around how we ensure the holistic health of people as we see the massive suffering taking place because of the pandemic itself, but also the ramifications, whether it comes to mental health, lack of income, hunger, all these things. I mean, the ramifications are so diverse. I'd love to hear your thoughts on your evolved thinking on how you ensure a holistic view on health and well-being.
Okay, thank you. Well, I'll give that Dr. Tedros a moment to prepare for that response, because it's a key issue. And while we're doing that, I'd like to take an input from Jan Lecam. Again, Jan, if you'd like to introduce yourself when you unmute and you put your comment and contribution.
Thank you very much. I'm Jan Lecam. I'm the chief executive of EUORDIS, the European Organization for Rare Diseases, but also founder of Rare Disease International. Good morning, Dr. Tedros. It's a pleasure to see you again with us and to take the time to discuss with us. My message is simply to insist on the impact of the epidemic of coronavirus on the already vulnerable populations. And obviously, coming from the rare disease, I will illustrate with that, but it absolutely works for many other vulnerable populations, and we are in solidarity with them. What we have observed is that, based on a survey to 7,000 patients and families who have replied to it, what we have observed is that 84% of them have experienced a disruption of care during the pandemic. And 60% of them declares that this interruption is detrimental to their health. For 1 in 10, they say it is definitely life-threatening. And for 2 out of 10, they say it is probably life-threatening. So this is running deep, and its interruptions, it's a cancellation of transplant, of surgery, it's disruptions in access to treatments, to blood tests, to medical imaging to monitor the diseases, or to chemotherapies. So really all sorts of disruptions at a level which is running in about 6 in 10 people. And what we observe is that also there is a huge mental health impact. 2/3 of them declares to have new mental health issues, such as depression or being scared or not being able to cope with activities that they usually cope with. On the positive note, though, we observe that 75% of the people declare that the family, the friends, and the neighbors are playing a bigger role than before the pandemic, and this is positive. So there is a resilience of the people around the patients themselves. So to put the patients at the point of care, as we just heard before. Thank you.
Okay, thank you so much. And I'm now going to pass back to the WHO to perhaps comment on that. And so we've heard 2 inputs. The first from Nina said, well, what's been the impact and implications on the overall health system and its, the chronic disease burden that it mostly spends its time dealing with? And secondly, we heard some input there about the impact on rare disease patients who are already suffering limited access. And for the WHO, I understand Dr. Tedros has left, but I'm delighted to speak in his stead, is the Deputy Director General, Mrs. Susanna Jakob. Susanna, obviously healthcare systems were already stretched in many areas, and we had to drop basic care. Some of it was delivered by digital tools, but whole areas of people with chronic diseases and rare diseases have seen their access to care affected. What do you think, from the WHO perspective, has been the implications on our health systems of having to shift all of the focus to deal with COVID? Susanna.
Well, good morning, and it's a pleasure to meet you, and I'm very pleased to be part of this process. I interacted in my previous life quite a lot with the Friends of Europe when I was regional director for Europe, and now working at the global level, of course, keep all the contacts with the EU and with the Friends of Europe. My name is Susanna Jakob, and I'm Deputy Director General, but also acting for the Executive Director of the Health Systems in WHO. And I appreciate very much this question, and actually the two questions are very much interlinked, because since the start of the pandemic, we have been extremely concerned about the disruption in the health systems, health services, and particularly in the disruption of critical health services and public health programs. And we have followed from the beginning disruptions in the immunization program, in the chronic diseases, in the communicable diseases, including TB, HIV, malaria, and all this, which were partly due to the repurposing of the staff, partly due to the overwhelmed health systems, but partly also due to the fact that the supply chains have been disrupted in many ways. But there was also one more element attached to this, and this was the fact that in many places, the parents were concerned to take the children to the health services because they were afraid that they would be infected by COVID. So it was a very complicated story, very many reasons behind the fact of this disruption. And since the beginning, WHO has been of the view that, of course, the first priority has to be to respond to COVID, and that has to be very clearly in the forefront. But on the other hand, we should make sure, as much as it is possible, not to disrupt the health services in the critical areas and to continue with the services like, for example, chronic diseases, cardiovascular diseases, cancer, as we heard from the previous speakers, or mental health issues, or the musculoskeletal diseases. The patients did not receive the appropriate care. So therefore, WHO initiated a process which we call the so-called BOOST program, in which we are working very closely not only with our country offices in all the countries, but also with the ministries of health, ministers of health in the countries, to ensure that we give a boost to the disrupted public health programs and make sure that they start to function and act again. And this is on the top of our priorities. And we are working with everybody, and obviously this also needs involvement of the different sectors, because, for example, to make the supply chain work, it has to be a global effort. And we are working with many of the partners in this. Thank you very much.
Thank you, Susanna. And it's very interesting to hear how the WHO recognizes some of the challenges, but has also put in place some activities. And maybe we can find links to your Boost program and share them in the chat with people so they can find out more about it. Let me turn now to some more interventions from people who want to share. And I'm going to bring in Francesca Colombo from the OECD. And it's an organization that's done a lot of research on areas around healthcare, and I'm sure you will want to pick up on some of the questions about how we keep the digital impact in our health systems and shifting to prevention. Francesca.
Yes, actually I had a question and then I can answer to what you're saying, Tasmin. I mean, the first question which I really would like to have posed to the panelists has to do to how to get out of this pandemic and this crisis and to continue to sustain the supports from populations and decision making, because there is certainly a certain fatigue, support for some of the measures that might impinge on individual liberties may weaken as we go farther. There's been also questioning on the scientific evidence, and there have even been people that are coming up to the idea that we should focus only on the vulnerable and let the other infected. And so I would be interested to know from the panelists what's their view in terms of how do we continue to gain and sustain the support for measures to fight the pandemic among the general populations, among all politicians, as getting out of it will still take quite some time still. And in response to your comments that you've made, Tamsin, I do think that there a number of innovations that we are seeing coming out of the epidemic. There's been obviously a lot that's happening in the digital space, telemedicines, telehealth. We heard about the interventions beforehand. But the question is that this innovation happening still in the background of health systems whose institutions were forged in the pre-digital era. And I think as much as a cultural transformation, there is also an institutional transformation that needs to be made to make sure that we can take best advantage of those innovations and accelerations. And obviously, that's something which is a comment, but possibly also a question for others of the panelists about how do they see as priorities to make sure that we have that institutional transformation as well, and not just the digital or cultural transformation.
Excellent. Thank you very much, Francesca. And I think I'm going to throw that question over to Ricardo as our token politician in the room. The question that we've had there that was raised by Francesca is, when we're trying to get out of the pandemic, we need population support for some of the measures. And that's a simple behavior change like wearing a mask, but it's also contributing to protecting the population by not doing risky behaviors. How do we, as somebody who you go to the population, ask for their vote, so you engage in dialogue with them. But 6 or 7 months after lockdown, there's a level of fatigue. There's a level of criticism. There's a level of skepticism. People are not necessarily interested in maintaining the level of discipline we need to keep the lockdown measures. So, Ricardo, do you have a magic answer? We always hope politicians have a magic answer. Do you have one?
Well, as a man of science and a physician, I'm not much of a magician, but I can try to address the question. I do agree with Francesca, and I'd like to greet her and also Susanna, under whom I was an intern at WHO. It's great to have her also among us. And to say that dealing with this issue, I think that it's all a question of messaging in a way. Because what we've seen is there is fatigue, which is fully understandable in the sense that people are fed up of being locked at home, not knowing what's going to happen next, fearing that their businesses are going to close, uncertain if they're going to keep their jobs. And so we need to redesign the way we are approaching our pandemic response. And what I mean by this is that the focus has to be, as I said in my first intervention, to move from the defense to the offense, which means that we need to make sure that people understand that our main focus is to keep our lives as normal as possible, keep our economy running, making sure that society is able to work in normal function or as normal as possible. Of course, it's not in a way that we can let go of the masks that we are now using, or other public health measures like physical distancing or washing our hands. But it is possible if we are more capable of having more effective testing, which means that it's not just about the number of tests, it's how we're testing, using other tools that have been made available like antigen testing, having more efficient isolating policies, making sure that if we have 1 to 5% of our population that is under risk, having had contact with someone who is infected, that we are providing the perfect conditions or the needed conditions for them to be able to stay isolated for 7, 10, 14 days based on what each country is recommending. Making sure that we are doing this, we will be able to contain the virus. We will be able to lower the number of new infections and make sure that society is moving forward. The thing is, what we're seeing right now is almost a denial of doing anything and just, forcing us to live as if it were normal times, which will lead to exponential growth of cases in the winter, which is a perfect storm bringing together COVID and influenza and other respiratory viruses. And in that perfect storm, then forcing us to lock down. And that will generate popular uprise. And I would say rightfully so, because people felt that their political leaders were unable to deal with this crisis. So redesigning our response to the COVID crisis is critical to make sure that we have the most effective health response that is preventing as many avoidable deaths as we can, and making at the same time possible that our societies can continue to function with some normality.
Thank you, Ricardo. And I'd now like to bring in somebody else from the audience, a member of the European Parliament, Maria Leitao, because we're now in the situation where we're talking about how politics helps make the connection between what the population needs to do as their contribution to dealing with the pandemic and how we move forward. Maria, please go ahead. You're on mute, Maria. Could you unmute yourself, please?
I'll
Excellent, thank you.
Thank you very much. For me, it's very important to know how the European data space is a priority in order to control this pandemic and be better prepared for the future, reinforcing our health systems. What I see, not only in Portugal, but all over Europe, that is we have the same data in different countries. And in fact, we have no common data to control this pandemic because we have no standards to collect this data, and the data are not, it's not possible to use them to develop not only research, but also more important means to control this pandemic. So Commissioner Breton told us in the Parliament, in the IMCO Commission, that European data space is a priority. And I think European health data space is the big priority nowadays. Is there condition to do that? It's what I would like to know from our inviters in this very, very, very interesting meeting. Congratulations to the Friends of Europe.
Okay, thank you very much. And I'm going to go back to Jean-Luc Lemercier, who spoke earlier, because he highlighted some of the challenges for the chronic disease patients who are across Europe. And again, he reminded us that even in the era of COVID, the #1 cause of death is cardiovascular disease, which is both preventable and can be better managed. So Jean-Luc, we've had interventions saying what's happened to the burden of disease. We had messages about if we manage it better, we could liberate the productive capacity of working age populations. Based on what you've just heard there, where do you see we've got an opportunity in a political space? The WHO said that now is the moment to rethink our health systems, and we have an opportunity to do more of the things that are needed. And the #1 point on Dr. Tedros's prescription is invest in public health. Would you agree with that? Where do you see we can make changes?
I totally agree with that. And investment is always a critical point. And the second point is how to use it. And we are living in Europe, which means it's a group of countries with a decent income. So you have funding available, and they need to be redirected properly to the healthcare system in the area which are impacting the treatment of population, the treatment of cardiovascular disease, because this is my specialty. And what this crisis has shown is how innovation can help in a crisis situation. Innovation are not designed to operate in crisis situation. They are mainly designed to have a contribution to patient for a given therapy. We have seen the digitalization, this minimal invasive producing positive effect during the crisis. Now, why the question is why it's not more used before the crisis and how it's going to be used after the crisis. And the reason why it's not more used is because the journey of an innovation in Europe for healthcare system require a lot of resilience to get to the practice. And in order to do that, you need to have a system which is able to assess those innovations, to properly utilize them, and to get them into the practice at a large scale to produce an effect. And what we have seen here is just a portion of what they can do in a crisis, but you can imagine what can happen if you have a larger utilization of digitalization. And digitalization is not only it's not only teleconsultation. Digitalization means as well for patients in heart failure. They can be monitored at home without going to hospital, just electronically. So this is where you have impact. But in order to do that, you just need more investment. You need more system which can integrate those innovations, which is a challenge each time for the society and for the inventor.
Thank you. I mean, good points there. Let me now turn back to Jana, because at the beginning you showed us some slides with your research showing the economic cost of ill health. But some of our other speakers, we just heard there from Jean-Luc, innovation doesn't happen in an emergency phase. And Francesca from the OECD said that one of the things that we have to do is remember that our healthcare institutions were forged at a different time. So if we're planning to update our health systems for the way forward, bear in mind that, number one, now is the window of time, the opportunity to do it. But secondly, emergency thinking is not conducive to innovation, and our institutions were created at a different time. So what's your advice about how we invest smartly, bearing in mind those challenges?
A great question. And you are indeed right that this is a moment where health is at the center of everyone's agenda. It is no longer just a challenge for healthcare professionals. It is the problem for businesses, for cities, for nations. Everyone is thinking of health. And I think from our perspective, given that it's very clear to the healthcare professionals, but not necessarily for everybody else, that prevention is so much more critical than treatment. And a lot of the actions and the changes that we would want to see would be to broaden our thinking of health beyond just the healthcare systems. So this really is an opportunity to try to keep health in the agenda of companies, making sure that they ensure their employees as well as their communities where they are active health. We can think of cities where people can grow, live, and age in a healthy manner. And these can go very long way of not just ensuring that we improve health and get the economic benefits and the growth that we need, and we counter some of the slowing demographic impacts on workforce growth. But at the same time, we will make Europe and all the regions more resilient for future pandemics, given, as many of the commentators have commented, the chronic diseases are a big burden, particularly on a pandemic, because those folks are much more vulnerable to not just to the severe impact of the pandemic.
Okay, thank you, Jana. Let me now bring in another input from the floor, and we're going to bring in Lubna Boafra, who, as I know, is an expert on AI. And we've been talking since our first input this morning from Dr. Bertela Meshko about how AI and digital is going to transform the way we can deliver care more efficiently, make the patient the point of care. Our MEP, Maria Letayo, talked about the importance of the EU health data space and how do we make it a reality, because that's going to be critical. Lubna, this is your play area, AI, digital, and you're already at the cutting edge. What would you like to contribute to our conversation?
Thank you, Tamsin, and thank you for having me here today. I think COVID showed us the importance to shift our healthcare systems from being hospital-centered to patient-centered. We tried to do that across the history, but we organized our healthcare systems around disease and hospital centers. And now we can see the member states that handled the COVID and the pandemic well, it's related or correlated to the number of IC beds and also the scale of testing. So how can we make that shift to be more patient and outcome centered, where we use technologies such as artificial intelligence that can bring us that focus and individualized response to patients? We saw COVID has been very, very discriminative towards a specific category of patients with cardiovascular conditions, with specific age group. And the response to COVID has been more at the national level now. And now we're even asking how can we tackle that on a European level, which will be great. But at the same time, we also need to think, how can we tackle it from the individual level as a patient? So while we're talking and we're repeating this virus has no borders, well, we saw member states that are neighbors having completely different spread patterns and responses to the virus. So the question is, it doesn't have a border, but how can we orchestrate our responses from the top-down hospital level, because that's what we have today as healthcare systems, but also from the bottom-up, from the patient level, that we can address these differences that we have across borders. How can we orchestrate a global response to across those different systems? That is very crucial. But I think the learning, the major learning we should take from here, this is we need to move quicker than we think to individualized healthcare, to individualized responses, and to driving patient outcomes rather than driving more a disease and specialization area in our healthcare system. So yeah, I would love also to hear from the co-panelists how do they see this orchestration of responses if we can see two neighbor member states having completely different responses.
Okay, before I let you go, Lubna, because you are an expert in artificial intelligence, and we've been talking about the EU health data space. Artificial intelligence learns from large data sets. So what do you hope that the EU health data space would do? What would it allow you to do to take the next level of artificial intelligence? Because if you can tell us where we should be heading for, that's what we should obviously be asking our European politicians to deliver for us. So if we could let free all of the data, what do you think you could deliver through artificial intelligence?
So in the ideal scenario, as an AI expert, I would love to the European data space addresses the right granularity level. So if we're going to talk about an image data across member states or across the health organizations, that's not enough, because that's still the old embryonic form of disease hospital system. If we're going to go there, we need to have the granularity level on the patient level, and that we collect data on that level and move away from collecting data for transactional and workflow purposes to collect data for evidence-based generation to drive outcomes for patients. So, and that will require a more European driven way of collecting data across European organizations across borders. So as much as we want to keep the member states leading the way for their own healthcare system, and we know why as well, but we also need to have that global ambition that we want to be leading the way in driving technologies such as AI and changing the culture, because the culture is the biggest barrier here. How can we show those algorithms help us to tackle diseases? And COVID has been one of the examples, which is much more global. How can we use data from patients in France to bring evidence to other patients in other member states? How can we, it's like donation, how can we donate the data for the best practices and move away from the disease specific to more the patient driven outcome prediction and driving healthcare for individual patients?
Thank you. Okay, we've had a very exciting conversation, but we have about 10 minutes left, and I would like to bring in a few more contributions from people who'd like to share things. So I think we have Pankaj Tagra who'd like to share something. If you could unmute yourself and introduce yourself. Pankaj, I hope I pronounced your name correctly. Hello.
Yes, perfectly. Good morning. Thank you. Very interesting discussion. And I have a question and a comment. My question is, topic of discussion is around digital divide. I think we had a very, very interesting startup in the morning from Dr. Bertling. I look after business for HCL Technologies, and it gives me an opportunity to work with some of the largest pharmaceutical companies and help them, to create more digital solutions for the end customers. What we see is that there is two kinds of speed. One speed is the commercially driven pharmaceutical companies who are very good at adopting, digital techniques, digital processes, and on the other side we see healthcare which is slow to adopt. And this pandemic only has given an opportunity to adopt telemedicine or more digital healthcare, but still the adoption has been quite slow. A digital medicine or digital healthcare can really transform the society. How do we make sure that we don't end up creating a digital divide within the society or among the institutions, that we have some private commercial institutions, who want to be commercially successful, end up being very strong digitally, and we leave the primary healthcare, we leave them behind, and then they are not able to follow the same digital acceleration. And second is, how do we make sure that the society and politicians and the governments make sure that the society is able to adopt and consume digital healthcare at the same level, and we don't leave few people far behind because they are not able to use those technologies.
Okay, thank you. It's a very useful input. And again, you're asking us all questions that we need to think about when we explore some of those issues. Let me bring in the next person who wants to share something. And I'm going to introduce John Lee Davey to come in and share with you. Could you please introduce yourself? And maybe you like to pick up on some of these elements. We're now talking about digital divide. Dr. Tedros said, invest in public health. Our previous speaker just said, yes, but make sure there's no digital divide at the public health area and the individual societies can adopt them. What would you like to share, John?
No, thank you. So I think you can see from my backdrop that I work for Vodafone. We are obviously fairly engaged in bridging the gap between digital and people. I think it's fairly well accepted now that mobile technology has proliferated society, and whilst it's been used for a number of years now in the delivery of healthcare services, I think we still acknowledge it's fairly early days. We're still amongst the use of early adopters. We do see, and this is my area of focus, is Internet of Things. We do see Internet of Things growing very rapidly, but it's still amongst the most innovative companies. And I think there's some way to go. I do think that there's the points that we've discussed around digital divide and the cultural transformation required, there's a lot of work to be done there. I think we have seen from our own experiences that that technology has a lot of different applications, from delivering new outcomes, better quality of life for patients, better product integrity in the way that it's tracking, for example, the temperature of vaccines being distributed. But there's an amount that can be done amongst the various different stakeholders, including the patients, employers, insurance companies. I think there's more work to be done across the board. But we do take our role fairly seriously as a technology enabler. So we're constantly looking to push innovation and work with each of those stakeholders.
So you see yourself as moving away from a sort of telecoms company to being part of the ecosystem that supports health.
Yeah, definitely. We are one component of that as a technology provider. We can't do this alone. No matter how much we wish to extend the range of services that we want to help our customers with. It's very important for us to be engaged. It's very important to us to understand the needs of the industry and also work closely on the ground and at government level to help foster innovation.
Okay, thank you. I'm going to pass to a few more contributions from the floor as we're coming towards the end of our time. Sami Sambu, what would you like to share with us? We're looking at how we put people at the heart of the way we rebuild our health systems, enabling it with data and with technology, but that it starts with the people. Sami, what would you like to share with us?
Yes, good morning to all of you. My name is Sami Sambu. I'm the managing director for Batnel Discovery, based here in Brussels, really focusing on using AI to improve clinical studies, make sure they're more successful and informative to patients and providers as well. My position really was that public health and education go hand in hand. If we don't invest in one or the other, then we don't have the synergy that's necessary to actually raise a citizenship that can fight against the ailments that we're looking at, like COVID. If you do not have an educated citizenry, then they are not able to actually take in all the evidence that is being provided and, act on that evidence so that we can defeat a disease like COVID. At the same time, when we look at the public health core that we have at every nation state, you find that there's been a significant level of attrition. And it's been amazing to me to see that some of the countries that are really low income, middle income, have much stronger public health cores than some of the more developed countries. And so in that case, they've had a much more rapid response to the pandemic, and naturally the results have actually borne out, that you see, high rates of infection in countries that do not invest in public health systems and do not have a standing public health core. So I think there's a lot to learn from that.
Okay, thank you, Sami, for your input. I'm going to bring in a few more people, and just as a reminder, we've got a limited amount of time left, and I want to get the maximum of input to our conversations. So let me now pass to Massimiliano Masciarini from Eurofound. Massimiliano, would you like to take the floor?
Yes, thanks a lot, and apologies for my picture that is frozen, but
no problem.
Yes, I am Massimiliano Mascarini. I am head of social policy unit at Eurofound. And thanks for taking the floor. It was a very interesting debate. And my question is actually, we are talking about rethinking world health system, and there is a word that I haven't heard mentioned too many times, and this is the word inequalities. So health inequalities in health, in access of health is for sure an important thing to address in a new health system, because we saw that the 2008 crisis has increased health inequalities due to the change in spending and investing of public health. This resulted in an increased share of people with unmet medical needs and a decrease of quality of the services provided, actually. Due to this, many of the people had to complement with private health insurance in order to still have that level of quality. Our survey on living, working, and COVID shows that in Europe, around the 9% of individuals has financial arrears in healthcare insurances. So so this is a large share due to the pandemic. And the question is, how we address this health and the healthcare system? Who is going to pay for investment in public healthcare and in holistic and preventative approaches in the world after and during the COVID, actually? Also in countries that are struggling economically with the huge fiscal exposure already. And this is very important because inequalities has also social implication. And we should not forget that this COVID crisis is a three-level crisis. We have an health crisis together with an economic and a social crisis.
Okay.
All of these has social implication. And so we should get out of the crisis by solving all of them together or in a coordinated manner.
Thank you, Massimiliano. And I'd just like to remind you that we've just shown you a cartoon that our cartoonist made at our conversation that I moderated on Monday, where we were discussing how we fund social protection. And it was highlighted to us that if you use the word inequalities and you take out the word "ini" at the beginning, you actually can then focus on the quality. So you're right to raise it, Massimiliano. And it's been a red thread through our conversations so far. We're coming towards the end of our time together, and the question we asked ourselves at the beginning is, how do we rethink our health systems? So in our last 5 minutes, I'd like to go back to the people who started our conversation today, starting with the WHO, and say, what's the last message you would want to leave us with when we explore this issue of rethinking our health systems? And I'll start with the WHO, with Susanna Jakob. If you'd like to share with us, what's the last message you would like to leave us with on the concept of rethinking our health systems? Just a soundbite, quick message. What would you like us to remember?
Well, first of all, we have to finish the pandemic. That's my first message. And there is a green light at the end of the tunnel by the ACTA, which is an unprecedented partnership with accelerated developments of innovations and tools like vaccines, therapeutics, and all this. And we hope that within the next couple of months, the new vaccine will be available. And then what we are starting to work on now is how we can prepare the health systems to deliver prepare the new vaccines to the population. The second issue I wanted to highlight is what Dr. Tedros said at the beginning, that we have learned a lot from the COVID, and there are 3 areas where we have to continue to invest in the health systems to make it more resilient. One is to be prepared much better for an infectious disease, for an outbreak, for an emergency. So we have to strengthen preparedness. We have to invest into the essential public health functions, but we have to make them as global goods, which are also funded by the governments, which has not been the case in all the countries before. And we have to invest into primary health care, starting from community-based care, but this should be coupled by access to digital innovation, digital health, which is a very important way forward. And then the final comment from me is that we should not think only about healthcare and health system, but we should think about health. Health overall, health for the people, for the population, which needs a new type of paradigm. It needs a paradigm in which we can look all the complexities of health, including the determinants, and this brings in the need for the whole of government, whole of society approaches. Excellent. I will stop here. And of course, we need a paradigm shift towards prevention, promotion, and this sort of activities, as was discussed before. Thank you very much, Tamsin, and thanks for the excellent moderation, as always.
Thank you. Let me turn now to you, Jana, because Susanna has just ended on that point about the need for a paradigm shift and a focus on health, not health systems. I'm sure that's something you would echo. What would you like to leave us with?
I would very much echo that. I think we need to move our mindset of caring for the sick to ensuring everybody is healthy, meaning keeping health at the center of everyone's agenda so we live and thrive before we need to go and see a healthcare professional. And I think we need to do the same on the innovation side. Let's just not focus on innovating on how we cure diseases, but also how we make it easier for people to make healthy choices, stay healthy. How do we make it easy for people to make the hard choices of exercising and choosing on the right kind of diet, etc. So we need a real mindset shift to thinking of how do we promote health rather than how do we treat illness or sickness.
Thank you, Jana. Let me now turn to Jean-Luc. What final messages would you like to leave us with? We've heard the importance of shifting the way we look at things, our conceptual framework around health. That is not about the systems, but about the people. We've heard again about the importance of prevention and doing things that work. Jean-Luc, what would you like us to leave us with as a final message?
Final message would be people, as mentioned by the previous speaker, should be at the center of the baseline for the thinking for redesigning healthcare system. People are the most important, and population. The second point is we need to invest smart. As I said, money needs to be properly allocated. And the major point we need to fix is to reduce the burden on hospital, increase their efficiency, and keep improving care for the patient.
Okay, thank you. And Ricardo, maybe we leave the last word to the politicians. How do you see that we should leave our conversation about rethinking health systems?
Well, Tamsin, I echo what Susanna said. We need to deal with the pandemic, but in parallel, we need to make sure that we have people thinking of the philosophical transformation that health systems truly need. The thing is that we don't have health systems at large. The industrialization of healthcare has made them into disease systems that are focusing on disease and fueling disease. And so we need to rethink our model so that we can actually have incentives that drive better health for all, which means that we are not only focusing on making sure that people are healthier in the system, but we are focusing on the community preventing disease, lowering the burden of disease. The second aspect, building on what was said by many of the people who participate, is on data and digitalization. Healthcare is one of the areas where digitalization has hit last. And so that is actually an opportunity for us to learn lessons from other sectors so that we can perform better, making sure that we have an inclusive digital transition, but also making sure that people understand for this to happen, we need very good data. You know, without data, we are unable to build up incentive systems focusing on better health outcomes and community-based outcomes. It is impossible for artificial intelligence to give us the decision supporting tools or even to dream about Internet of Things in larger sense within the health ecosystem. So we need better data and possibly thinking of monetization of data or finding ways to incentivize people to give out their own data. And my last point would be a bit more generic, but it has tremendous impact on our health at large, which is rethinking our economic models, which are currently focusing on growth focused on GDP. We need to move away from economic growth focused on GDP towards economic growth focused on well-being. Without having economic growth that can trickle down to the people, we will not address the inequalities that are the main driver of poor health, especially among the most vulnerable.
Thank you very much, Ricardo, and thank you to our global audience who've helped us have this conversation about how we rethink health systems. We started by acknowledging that the pandemic, COVID-19, has been a transformation event. It changes everything. It changes the way we think about ourselves, about our societies, about our healthcare systems. It's impacted our economies to an unprecedented level. So what do we need to do? We explored in our conversation the paradigm shift that we need to make for our health systems. We need to move away from looking at transactions, hospitals, and systems to putting things at the patient being the point of care, where technology supports their access, where it allows an empowered healthcare professional to deliver something better. We talked about how at European level, the plans for European health data space hold much promise, but it needs to be at a level of granularity and detail that allows us to release the potential of artificial intelligence to support this transformation. We heard that it's not an easy time to make decisions when you're doing emergency preparedness. And we had a word of warning, not to look back at our healthcare systems, which were created at a very different time, but to look forward, to future-proof our health systems so they can deliver more and better, so that we address inequalities. We heard a call to make sure we don't leave people outside, to be aware of inequalities in society and digital gaps, so we don't end up increasing people who are outside our system. The message is clear. We have so much to gain. When we look at health differently, instead of looking at it how much it costs us to deliver care, but we start to look at what is the economic potential we release in our society if we can get better health. We saw the data shared by our partner McKinsey Global Institute looking at how much more productivity and 10 healthy life years we could get if we can get this right, if we connect all of society, if we connect all of government, if we collaborate, and if we continue the best of what came out of our pandemic response, our collaboration, our getting out of our silos, our shared understanding that we have a future together if we work together. If we can keep that going, the acceleration of digital, then we have much to gain as individual countries, as regions, and as global things. So I'm going to conclude this session. Thank you all for participating. Much food for thought. Those of you who are staying on Zoom, please continue sharing, continue the conversation. You can keep tweeting on State of EU. You'll find the video from this session on the Friends of Europe website. Please feel free to share and watch again, give it to a broader audience, because this healthcare systems and rethinking, it's about all of us. It's about the kind of societies we want to live in, and we all have a part to play. Later today, here at Friends of Europe, we're going to be feeding the mind. We will have a cultural activity at 5 o'clock. We have a piano concert by Alexandra Dariescu. And tomorrow we have more exciting content to give you here on screen. You can see we're going to start by looking at the issue of racism and how in Europe we can address this, that is continued discrimination. We'll also be picking up again on some of the issues that we talked about today, digital, how we bring everyone in together and how it's used to help shift Europe to the kinds of economy and societies we want in the future. And then we'll be closing towards the end of the day, coming back to this issue about citizens. All throughout this week, we've been sharing the results of the polls that we have, where we ask citizens what their priorities should be, and that will be part of our closing moments tomorrow. We also encourage you to participate with our citizens' engagement on our Debating Europe platform, where we have about 5 million citizens already engaging and talking about Europe. This is the place where we want to hear from you. We will also be interviewing citizens with their hopes, their ambitions, their desires and objectives for what they want. And at 6:30 today, you'll see some of that. So we have a wonderful day of activities today and tomorrow. Thank you for being part of it. Stay safe. See you again soon.
Thank you, Tamsin.